Teach Me to Help, Module 3, Lesson 5, Assertive Behavior in Online Communication, Behavioral Pattern. 1. Introduction to Assertive Online Communication and Behavioral Models for People with Disabilities. Online Communication for People with Disabilities. Online communication is the process of transmitting and receiving information through digital technology and the Internet. It's an important form of interaction in the digital age, enabling people with disabilities to connect with others. For individuals with disabilities, this type of communication is particularly important as it allows them to avoid the need for physical travel, which can be challenging. This accessibility fosters greater inclusion and participation in social, educational, and professional contexts, enhancing the quality of life and opportunities for those who might otherwise face barriers to engagement. Key aspects of online communication for people with disabilities. Online communication, live chats or video conferences, emails, direct messages, or posts on social media platforms. Platforms, instant messaging apps, WhatsApp, Telegram, Signal. Social networking platforms, Facebook, Twitter, Instagram, LinkedIn. Collaboration apps, Slack, Microsoft, Teams, Google Workspace. Video conferencing platforms, Zoom, Google Meet, Microsoft Teams. Online communication etiquette. It's important to maintain a professional and respectful tone. Respond promptly to messages and ensure that the information you share is accurate and reliable. Impact on society and personal life for people with disabilities. Online communication has facilitated remote work, online learning, and opened new ways of social interaction. However, it can also bring challenges such as dependence on technology, work-life balance issues, or mental health problems. For people with disabilities, this aspect can be particularly important. Assertive behavior. What is it? Assertive behavior is a method of communication and action that involves expressing one's own thoughts, feelings, needs, and rights in a direct, honest, and appropriate manner, without violating the rights and feelings of others. This form of behavior consists of having confidence in oneself and the ability to communicate this confidence to others. For trainers working with people with disabilities, it's essential to be direct, honest, active, respectful, balanced, confident. Assertive behavior models for people with disabilities. Assertive behavior. 1. The cognitive behavioral model. It is based on the idea that people's thoughts and perceptions influence their behavior. 2. The behaviorist model. Behavior is determined by external stimuli and is shaped through conditioning, either positive, reward, or negative, punishment. 5. The biopsychosocial model. Behavior is the result of the interaction between biological factors, genetics, brain chemistry, psychological factors, personality, behavior, and social factors, culture, interpersonal relationships. Two, benefits of assertive behavior in online communication for a course for people with disabilities. 3. The psychodynamic model. Behavior is influenced by impulses, desires, and conflicts that occur at the unconscious level of a person with disabilities. 4. The humanistic model. People with disabilities are motivated to improve their lives and behavior. Increasing communication efficiency for people with disabilities. 1. Building a clear message for people with speech impairments. 2. Writing in Braille for people with visual impairments. 3. Reading a clear message for people with hearing impairments. Expressing viewpoints in such a way that people with disabilities feel heard. People with disabilities can improve their self-confidence and ability to assert themselves in front of others. Open and honest expression of feelings and needs can reduce stress and anxiety levels. Three, assertive communication for people with disabilities. Assertive communication for people with speech disabilities. Types of speech disabilities. Dyslalia. It is a disorder of the articulation of speech sounds, which can cause certain sounds or words to be pronounced incorrectly. Aphasia is an acquired disorder that affects the ability to communicate, often as a result of brain injury, for example, following a stroke. Dysarthria involves difficulties in controlling the muscles used for speech, resulting in unclear or hard to understand speech. Fluency disorders, stuttering and cluttering. Stuttering is characterized by involuntary interruptions in the flow of speech, including repetitions of sounds or syllables, prolongations of sounds and blocks, absence of sound. Emotion and social situations can exacerbate symptoms. Cluttering is a less known disorder, marked by a fast and or irregular speech rhythm, which leads to unclear speech. People with cluttering may also have difficulties in organizing their thoughts for speech. Selective mutism. Selective mutism is an anxiety disorder where a person who is capable of speaking in certain situations or contexts, example, at home, does not speak at all in other situations, examples, at school or in public places. Speech apraxia. Speech apraxia is a motor speech disorder where a person has difficulty coordinating the movements necessary to produce sounds and words correctly, even though they want to and know what they want to say. Assertiveness in communication plays an important role when interacting with people who have speech disabilities. This communication style, which is based on the direct and respectful expression of one's own needs and feelings without infringing on those of others, is particularly important in the context of individuals with speech disabilities. Assertive communication for people with speech disabilities. Promote respect and understanding. Improve communication efficiency. Support autonomy and independence. Encourage adaptability and flexibility. Strengthen social skills. Increase awareness and sensitivity. Assertive communication for people with hearing disabilities. Types of hearing disabilities. Conductive hearing loss. Problems in the outer or middle ear prevent sound from reaching the inner ear. Sensorineural hearing loss. Damage to the sensory cells in the inner ear, cochlea, or the auditory nerves, which can prevent sound signals from being correctly transmitted to the brain. Mixed hearing loss. Combines elements of both conductive and sensorineural hearing loss, affecting both the middle or outer ear and the inner ear or auditory nerve. Neurosensory hearing loss. Combines elements of both conductive and sensorineural hearing loss, affecting both the middle or outer ear and the inner ear or auditory nerve. Unilateral and bilateral hearing loss. Unilateral refers to hearing loss in one ear. Bilateral involves both ears and can vary in severity. Fluctuating and permanent hearing loss. Fluctuating changes over time, often due to medical conditions such as ear infections. Permanent does not improve and remains constant. Presbycusis. This is a form of hearing loss that occurs naturally with aging, particularly affecting the ability to hear high-pitched sounds and to understand speech in noisy environments. How to communicate assertively with people with hearing disabilities. Use body language and facial expressions. Maintain eye contact. Use clarification techniques. Adapt your communication methods. Reduce background noise and ensure good lighting. Use written communication when necessary. Be patient and respectful. Assertive communication for people with mobility disabilities. Types of mobility disabilities. Cerebral palsy. Describes a group of permanent disorders of the development of movement and posture, causing activity limitations. Amputations. Involves the surgical removal of a limb or part of it, whether it's a leg, hand, finger, or toe. Arthritis encompasses over 100 conditions that affect the joints, the tissues that surround the joints, and other connective tissues. Spinal cord injuries. Spinal cord injuries, SCI, can lead to partial or total loss of motor and sensory functions below the level of the injury. The severity depends on the type and level of the injury and can range from impairment in one limb to paraplegia, loss of movement and sensation in the lower parts of the body, or quadriplegia, loss of movements and sensation in all four limbs. Muscular dystrophies represents a group of genetic diseases that cause progressive muscle weakness and loss of muscle tissue. Over time, these conditions can affect the ability to walk, breathe, or move the arms. Spina bifida, a congenital malformation of the spine and spinal cord that occurs when a fetus's spine does not close completely during the development in the womb. Multiple sclerosis, a disease of the central nervous system that can affect the brain, spinal cord, and optic nerves. Polio and post-polio syndrome. Polio is a viral disease that can cause temporary or permanent paralysis. Post-polio syndrome refers to a set of debilitating symptoms that can occur decades after the initial infection, including progressive muscle weakness and fatigue. How to communicate assertively with people with mobility disabilities. 1. Adopt a positive and respectful perspective. 2. Eye-level communication. 3. Active listening. 4. Encourage independence. 5. Clarity and specificity. 6. Use respectful language. 7. Be aware of the environment. 8. Feedback and adaptation. Assertive communication with people with visual disabilities. Types of visual disabilities. Myopia and hyperopia. Myopia, nearsightedness, allows individuals to see close objects clearly, while distant objects appear blurry. Hyperopia, farsightedness, affects the ability to see close objects clearly, making them appear blurry. Astigmatism, caused by an irregularly shaped cornea, which leads to distorted or blurry vision at any distance. Presbyopia, difficulty in seeing close objects clearly. Macular degeneration, both dry and wet forms can lead to the loss of central vision. Glaucoma, a group of eye diseases that damage the optic nerve. Cataract, the most common cause of vision loss in people over the age of 40. Diabetic retinopathy, a complication of diabetes that affects the blood vessels of the retina. Blindness and severe vision loss. Blindness involves the complete loss of vision. Severe vision loss refers to limited vision that impacts the ability to perform daily tasks even with the aid of visual assistive devices. How to communicate assertively with people with visual disabilities. Communicating with the visually disabled. 1. Introduce yourself and identify the people present. 2. Use clear verbal descriptions. 3. Offer precise directions. 4. Do not change the volume of your voice. 5. Announce when you are taking breaks during the course. 6. Be open to feedback. 4. Strategies for implementing assertive behavior online. Avoiding ambiguities in an online course for people with disabilities. Use clear and simple language. Be specific. Avoid implicit messages. Use I statements. Support autonomy and independence. Active listening in an online course for people with disabilities. Active listening. Clarify and verify understanding. Reflect and rephrase. Do not interrupt. Show empathy. Provide constructive feedback. Express appreciation. Be polite. Expressing personal needs and expectations in an online course for people with disabilities. Expressing needs. Setting boundaries. Respecting participants' boundaries. Confronting boundary violations. Flexibility of boundaries. 5. Examples of assertive online communication for a course for people with disabilities. Clarity in instructions. Use clear and concise language when giving instructions to avoid confusion. For example, you can say, I would like everyone to mute their microphones when not speaking to avoid background noise. If you have questions, please write them in the chat and we will have a question and answer session at the end of the lesson. Setting expectations. You can be assertive in setting expectations for the online class. For example, I expect everyone to be respectful towards each other. If you see someone making mistakes or struggling, please do not criticize them. Each of us learns at our own pace, and we all deserve patience and understanding. Responding to inappropriate requests or behavior. It's important to be able to respond assertively when confronted with inappropriate requests or behavior. For example, if a participant asks to receive the answers to a test, you can say, I understand that you want to succeed in the test, but it's not fair or ethical for me to give you the answers. Instead, I can offer you more learning resources, or we can discuss the topics that you find challenging in more detail. Encouraging open communication. You can encourage participants to express their needs and concerns. For example, you might say, "If you ever need additional help or have suggestions on how we can make this course more accessible and useful for you, please contact me. I want to ensure that everyone has the opportunity to learn and succeed." Adjusting teaching methods. You can adjust your teaching methods to meet the individual needs of your participants. For example, if a participant with visual disabilities has difficulty following screen presentations, you could say, "I understand that screen presentations can be challenging for you. I will make sure to verbally describe any visually presented information and also send you a text transcript to the presentation after each lesson." Example of assertive communication via email. Let's assume we have a person, Alex, who has a physical disability and is participating in an online course. Alex receives an email from a course mate asking him to complete a task that requires intensive use of the mouse, which is difficult for Alex. Instead of ignoring the request or attempting it and feeling frustrated, Alex responds in an assertive way. "Hello, thank you for your email. I enjoy collaborating, but intensive mouse use is difficult for me due to my disability. Can we together find an alternative to this task that would be more accessible for me?" Assertive communication in video conferences. Maria, a person with hearing impairments, is participating in a video conference as part of the course. She notices that some participants do not activate subtitles when they speak, causing her to miss some parts of the discussion. Maria sends a message in the conference chat. "Hello everyone. I would appreciate it if you could activate subtitles when speaking. I have hearing impairments, and this would greatly improve my participation experience. Thank you very much." Assertive communication on social media. Marianne, a person with learning disabilities, is participating in a study group on a social media platform. One of the members frequently posts materials that are not clearly structured, causing difficulties for Marianne. Instead of withdrawing from the group or remaining frustrated, Marianne decides to send a private message to the member. "Hi, I appreciate your contribution to the group. However, I would appreciate it if you could structure your posts more clearly, perhaps with bullet points or separate paragraphs. That would help me a lot because I have learning difficulties. Thank you for understanding." Case studies to illustrate assertive versus non-assertive behavior. Case study 1. Requesting reasonable accommodations. Non-assertive behavior. Alex struggles to use the platform as it is, feeling frustrated and disappointed. He does not express his issue to the instructor. Assertive behavior. Alex sends an email to his instructor, clearly and respectfully explaining the problem he is facing. He requests reasonable accommodations, such as using a more accessible platform or providing course materials in a different format. Case Study 2. Participation in online discussions. Maria has a hearing impairment and participates in an online course that involves many audio discussions. Due to her impairment, Maria struggles to follow the discussions. Non-assertive behavior. Maria does not participate in discussions and does not inform the instructor about the difficulties she faces. Her grades suffer due to lack of participation. Assertive behavior. Maria contacts the instructor and explains her situation. She suggests possible solutions such as providing transcripts for discussions or using a captioning system for videos. These case studies illustrate the importance of assertive behavior in online communication, especially for people with disabilities. By clearly expressing their needs and requesting reasonable accommodations, they can have a much more positive and productive online experience. 6. Modeling assertive behavior. How can assertive behavior be modeled for each category of disabilities by the trainer in an online course? Utilizing video materials. Speech disabilities. Present videos that model conversations using sign language, communication assistive apps, or simply patience and clarity in speech. Hearing disabilities. Include videos demonstrating how to maintain eye contact, use body language and facial expressions to support communication, and ensure you are in an environment suitable for lip reading or sign language use. Mobility disabilities. Demonstrate through videos the importance of accessible spaces and necessary adaptations, as well as how to provide physical assistance only when requested. Visual disabilities. Show effective guiding techniques, how to describe the environment clearly, and how to use verbal descriptions to compensate for the lack of visual information. Simulations and interactive scenarios. Create interactive scenarios where participants can choose different response options in stimulated situations, providing instant feedback on the effectiveness of their choices. These can include various scenarios for each type of disability, highlighting the importance of communication and behavioral adjustments. Virtual role-playing games. Organize live or recorded sessions where participants can practice and demonstrate assertive communication skills in alternate roles, receiving feedback from peers and instructors. These can be conducted through video conferences, allowing participants to experience and discuss different approaches. Discussion forums and groups. Utilize online discussion forums and groups to allow participants to share experiences, strategies, and challenges encountered in communicating with people with different types of disabilities. This can promote collaborative learning and the development of a community of practice. Further resources and reading. Provide access to articles, books, and other resources that offer additional information and diverse perspectives on assertive communication with people with disabilities. This may include case studies, current research, and relevant theories from psychology and education. Personalized feedback and evaluations. Include assessments and opportunities for personalized feedback to help participants understand their progress and areas needing improvement. This can be done through quizzes, reflection journals, and individual online meetings. Using feedback to improve assertive behavior. Constructive feedback from instructors or course peers. Instructors or course peers can provide constructive feedback on how participants communicate. For example, if a participant did not clearly express their needs or limitations, the instructor or course peer may notice this and suggest ways to improve. Self-assessment and personal feedback. Participants can be encouraged to reflect on their own behaviors and performances. This may include questions such as, "Was I clear in expressing my needs?" or "How could I improve my active listening?" The role-playing and immediate feedback. Role-playing can be an effective way to practice and improve assertive behavior. Participants can engage in pairs or divided into small groups to play out various scenarios. After each scenario, participants can receive immediate feedback from their role-playing partners or from the trainer. Technology-enabled feedback. Some online learning platforms have features that allow for automated or real-time feedback. For example, some platforms may have a peer assessment system that allows participants to receive feedback on their assertive behavior. Incorporating feedback into improvement plans. Following the feedback received, each participant should have a personalized action plan for improving assertive behavior. This plan may include specific objectives, strategies for achieving these objectives, and methods for monitoring progress. For people with disabilities, feedback can be adapted to take into account the unique needs and circumstances of each individual. For example, for a person with a hearing impairment, verbal feedback can be replaced with written feedback. By using feedback strategically, the course can help participants improve their assertive behavior and communicate more effectively in the online environment. Practical exercises for modeling assertive behavior online. Role-playing scenarios. Participants can be placed in specific scenarios where they need to exercise their assertive communication skills. For example, a scenario could involve requesting reasonable accommodations for an online course. After role-playing the scenario, participants can receive feedback and discuss how they handled the situation. Active learning exercises. Within a group or pair, one participant can share an experience or opinion, while the other focuses on active listening. Then, the listener can summarize what they heard to demonstrate understanding. This exercise can help develop active listening skills, which are essential for assertive communication. Assessment and reflection on previous interactions. Participants can be encouraged to reflect on their previous interactions and evaluate whether they were assertive or not. This self-assessment process can provide valuable learning opportunities. Exercises for expressing needs and expectations. Participants can be encouraged to write their own scenarios in which they should express their needs or expectations assertively. This can help develop skills for expressing their own needs in a respectful and effective manner. Exercises for handling feedback. Participants can receive feedback from other participants or instructors and can be encouraged to use this feedback to improve their assertive behavior. They can also be encouraged to practice giving feedback in a constructive and assertive manner. Relaxation and stress management techniques. An important aspect of assertive behavior is the ability to manage stress and negative emotions. Relaxation exercises such as deep breathing or meditation can be helpful in helping participants feel calmer and more confident in their assertive expression. Role-playing scenarios. Let's assume a participant has a visual impairment and requires course materials in audio format. A role-playing scenario could involve the participant assertively, clearly, and respectfully requesting these adaptations from the instructor. Active listening exercises. A participant with a physical disability shares their experience of participating in the online course, focusing on the challenges they've encountered. The other participant listens attentively, refrains from interrupting, and provides a summary of what they heard, validating the feelings and experience of the first participant. Exercises in expressing needs and expectations. A participant with a hearing impairment writes a scenario in which they need to request a sign language interpreter for live video lessons. They should be direct yet respectful, ensuring that their needs and expectations are well understood. Assessment and reflection on past interactions. A participant with a learning disability reflects on a recent interaction with a fellow coursemate in which they felt embarrassed. They analyze whether they reacted assertively or if they could have handled the situation differently. Exercises in managing feedback. A participant with mobility disabilities receives feedback from their peers that sometimes their needs are not clearly expressed. They take the feedback constructively and commit to working on the clarity of their communication. Relaxation and stress management techniques. A participant with anxiety practices deep breathing exercises or meditation before attending the course or engaging in difficult interactions. This helps them calm down and approach communication in a more assertive and balanced manner. 7. Challenges and solutions in practicing assertive behavior online. Confronting passive-aggressive or aggressive behavior online. Confronting passive-aggressive or aggressive behavior online can be challenging, but there are strategies to do so assertively and respectfully. Identifying the behavior. The first step is to identify passive-aggressive or aggressive behavior. This may include sarcastic or offensive comments, sarcasm, ignoring or avoiding direct communication or intimidation. Maintaining calm. Confronting passive-aggressive or aggressive behavior can be stressful and can evoke strong emotions. It's important to try to remain calm and not respond in the same manner. Taking a break before responding to manage emotions can be helpful. Direct and clear communication. Address the behavior directly but respectfully. Tell the person what you've noticed and explain why it's a problem. For example, you could say, I've noticed that your messages tend to be sarcastic, and this makes it difficult for me to understand what you're trying to communicate. Can you express your thoughts in a more direct way? Setting boundaries. If the behavior continues, it's important to set clear boundaries. You can say something like, I appreciate respectful and direct communication. If this is not possible, I will have to limit our interactions. Seeking support. If you feel threatened or harassed, it's important to seek support. This may involve seeking help from a trusted counselor or mentor. Self-care. Confronting aggressive or passive-aggressive behavior can be exhausting. Make sure to take time to take care of yourself and your emotional needs. How to remain assertive in the face of others' negative behavior. Remaining assertive in the face of others' negative behavior can be challenging, but is essential for maintaining self-respect and effective communication. Here are some suggestions on how to proceed. Remain calm. Strong emotional reactions can impair clear thinking and may encourage a negative response. Try to remain calm and focus on responding calmly and rationally. Use I statements. Instead of accusing or criticizing, express your feelings and needs using I statements. For example, instead of saying, "You never," you could say, "I feel ignored when." Be clear and specific. Instead of complaining in general terms, be as specific as possible about what bothers you. For example, instead of saying you're always negative, you could say, "When you constantly criticize my ideas, I feel discouraged." Set boundaries. If negative behavior continues, it's important to set and maintain clear boundaries. This may mean refusing to interact with the person until their behavior changes. Don't take things personally. Often, others' negative behavior has more to do with their own issues than with you. Try not to take their behavior as a reflection of your worth. Practice active listening. Confronting negative behavior may be more effective if you demonstrate that you understand the other person's perspective. Active listening can show respect and empathy, even when you disagree with the person. Self-care. Confronting negative behavior can be stressful and exhausting. Make sure to take time to take care of yourself, rest, and relax. Remaining assertive in the face of others' negative behavior requires practice and patience, but it's an essential skill for healthy and respectful interactions. Solutions and resources to maintain assertive behavior. Applications and technology. For individuals with certain types of disabilities, technology can provide tools to facilitate assertive communication. For example, there are apps that can help people with speech impairments communicate more effectively, or software that can make internet navigation easier for people with visual impairments. Constructive feedback and practice. Within an online course, ongoing instruction and practice, along with constructive feedback from trainers and colleagues, can be particularly helpful in maintaining and improving assertive behavior. Keep in mind that each person is unique, and what works best for one individual may not work as well for another. Thank you for your attention.